Thank you, Dr. Colfax, and we look forward to hearing more about the progress of the National HIV and AIDS Strategy. Next, we have Dr. Alan Greenberg, the director of the NIH-funded DC Developmental Center for AIDS Research. He's also an internationally renowned expert in the fields of epidemiology and HIV. Let's give him a round of applause.
Thank you, Lisa, and thank you, Dr. Rana, and the conference organizers for this opportunity to speak with you this morning and to welcome you to this important conference on HIV and stigma. As I said, my name is Alan Greenberg. I'm the director of the District of Columbia Developmental Center for AIDS Research, known as the DCFAR, which is a NIH-supported research center and represents a collaboration of the major 6 academic institutions in Washington, D.C. that conduct HIV/AIDS research. That would be Howard University, and we have Dean Wuto, either is or was in the room a little minute. He's our institutional representative from Howard. Georgetown University, George Washington University, where I'm from, American University, and we have our institutional representative from AU, Kim Blankenship, here in the audience this morning, Children's National Medical Center, and the Veteran Affairs Medical Center. We represent over 160 academic faculty members who conduct HIV/AIDS research, and on behalf of the academic community of Washington, D.C., I'd like to extend a warm welcome to all of you this morning. The DCFAR is proud for the second time to be a co-sponsor of this important meeting on HIV and stigma. The DCFAR provides services and infrastructure and pilot funding to promote and support HIV research and new investigators in Washington, D.C. And if you want to learn more about it, we have a very extensive and involved website. You can just Google DCFAR. The DCFAR has a very active community advisory board. It's sort of an executive community advisory board, which has represented many of the leaders and CEOs of the community-based organizations and other community advisory boards that work with HIV research in Washington, D.C., and they've encouraged us to promote research in highly stigmatized populations. So the CFAR has responded, and we've created 3 scientific working groups that focus on populations that are experiencing and have experienced high degrees of stigma. One is on men who have sex with men and other sexual minorities. One is on criminal justice affected populations. And another is on the people suffering from the syndemics of mental health and HIV infection. Our CAB is also encouraging us to develop one on HIV in women as well. So in sum, the academic community of Washington, D.C. is highly supportive of this conference. This is actually the 3rd major HIV conference that many of us have attended this week in Washington, D.C., which I think is a testament to the fact that Washington, D.C. is truly becoming a true center for AIDS and AIDS prevention and AIDS research here in the United States. So thank you for allowing us to participate, and I wish you great success in this conference.
Thank you, Dr. Greenberg. All right, our keynote speaker today is Ms. Michelle Lopez, who is a relentless advocate in the fight against HIV and AIDS. Her inspirational work and story has been featured on The Oprah Winfrey Show, in Marie Claire Magazine, on CNN, and many other media outlets as well. Now, she and her daughter Raven also featured in the new CDC HIV stigma campaign, Let's Stop HIV Together. So, ladies and gentlemen, let's welcome Ms. Michelle Lopez.
Thank you, Sine. And good morning to each and every one of you. I'm from the Caribbean, so I just can't help it. It's good to be here, and I really have to say, in fact, you know, God works in mysterious ways. You know, I pretty much was really featured to be speaking on a panel, and then I got the exceptional call, Michelle, can you keynote? at the conference, and I was like, wow, here I am, because I really have to say for the last 22 years of myself and my daughter's life living with HIV, later on, if any of you are in the youth conference, you guys are going to get a chance to have some dialogue with my daughter, Raven. I have to say, stigma, discrimination, my goodness, I think we have lived it, and pretty much is what we have done with it. Because, you know, addressing the conference here today, as I pretty much started out saying, I'm originally from the Caribbean. I have two wonderful children. My son, 25, he's negative, and having to raise a baby, in fact, well, I have to say raise a baby because my diagnosis came right after the birth of my daughter, her actually starting showing symptoms of a child. And you would think it's a, it's a newborn baby. Why is this baby getting sick? I did not know my status during my pregnancy. I was never offered testing, even though I think I lived in the Mecca state, the state of New York. I live in New York right now. And I was engaged, I had good prenatal care. I had private insurance. I was never asked or offered to take an HIV test. So we are speaking, yes, 22 years ago, but I think my point of understanding the impact of stigma and how stigma pretty much, curtails within the lives of those of us living with HIV, it started even before this baby was born. So here I was, a woman of color. I do identify, I would say, I identify as a Black Latino. I would be amiss if I do not acknowledge my heritage. I think even before that rapper made that song, Morena Latina, my dad always called me his little Morena Latina baby. So this is how I pretty much, knew myself, within my heritage. So when this baby started getting sick, at the age of 9 months old, here I was in and out of the emergency rooms with her thinking, this baby was, healthy at birth, what's going on? It was not until, in fact, I also, too, at that point in time in my life, I was living in a situation as a battered woman. And I truly believe today, because of my journeys and my experiences, I really do understand the syndrome of a battered woman. Because I didn't leave. I was in a situation, I viewed myself also too, as I started out saying, I'm from the Caribbean. So here I was, I'm an immigrant, I'm living in the United States, pretty much waiting for this dream because my daughter's father at the time, had promised me, we're going to get married. I'm going to help you get your green card. So I'm going to tie in quite a bit of issues because I also to view myself, many of us as immigrant women or immigrants, we're very vulnerable to quite a lot of impacts that comes into our lives and not realizing, here we are chasing this dream. So I remained in a situation of a battered woman not until I have to say this one particular night. It was one of the worst beatings that I ever encountered, but I have to say, and I truly mean this, it was the best. Because of that beating, I finally left. And here I am today because I do not believe if I hadn't left that situation. And I rode the train. I wrapped my baby in a blanket. I remember having 2 baby bottles of milk for her, and I rode the train, and I kept riding the trains, switching from different boroughs. At that time in New York, I lived in the borough of Queens, and my final part of my journey on this train, I ended up on a train in the borough of Brooklyn. And here I was, and I'm just looking at ads on the train, and whatever was going through my mind, it was just a lot. And I remember bending my head at one particular time, and I'm saying, God, whatever that you have in store for me, just do it. And I looked up and I saw an ad on the train, and the train said, this ad says, if you're a woman and you're in a domestic violence situation or you're having to deal with drugs, if you're uninsured, call this number and you can get help. And I did. I called the number. I actually got off the train, and I'm going to pretty much really say I'm a person, many of us have our beliefs, and I'm a true believer in the God that I serve, because I got off the train, and at that time, I was standing at the corner, I got on a public phone, and I was standing at the corner of Nevin Street and Flatbush Avenue in Brooklyn. And when I called that number, a voice answered the phone. Many a times we call these hotlines or we call numbers and we get a recording, a voice answered the phone. And when that voice answered the phone, I broke down. And I started just saying to this person, it was a female that answered the phone, and she was an organization that I have to say, eventually I became an employee of this organization and worked there for the last 19 years of my life, because there are still hundreds and hundreds of Michelle Lopez's that are out there. But when I spoke to that person at the end of the line, and I told this person, I just started sharing what my years and what my life pretty much entailed. She asked me, "Where are you right now?" And I said, "Miss, I'm standing at the corner of Flatbush Avenue and Nevin Street." And as part of my testimony, I have to say, she said, "Ma'am, if you turn around east where you're standing, I'm 5 blocks away from where you're actually talking to me, and you will find me there. I'm an employee at this time, the organization that I'm speaking about, and I always tend to give praise because this is a local Article 28 facility in New York, community healthcare network, and to know at that time, I never expected the journey and where my life was going to take me, but I walked into that facility, and I have to say, being uninsured, having a newborn baby, I never received my postpartum care because after having this baby, being an immigrant, I had what we call PCAP Medicaid, but once your baby is born, you no longer have any health insurance, so I never had my postpartum visits. And that day, what I shared with the staff at that facility and that program, I was then asked, would you like to take an HIV test because of situations that you've explained to us, and you have a newborn baby, you might be at risk for someone exposed to HIV. This is how it was explained to me, and I agreed to the test. I publicly shared that whole event that day because I was not just walking around with HIV. I also too was, at that same day, in fact, I was told I had gonorrhea and I had to be treated for it. So I pretty much really got into healthcare at that point in time with no health insurance, but this was a local, again, health center that pretty much really was filling the gap. What I see today, a lot of gaps that are still out there for many of us, within uninsured, immigrant, a woman. And I got into healthcare, but I also too, within that same period, myself and my daughter had to be placed into a battered shelter for women, and that's where my journey started. 2 weeks into me being in that shelter, this is when I found out that both myself and my baby was diagnosed with HIV. Unfortunately, one of the beliefs that I have within my head, and I think many of us, we don't get the chance to talk about some of the things that we have fixated in our head. I was not aware of breastfeeding and how breast milk can transmit HIV to a baby. And I breastfed, my daughter was she was a breastfed baby because I thought at this time in my life, this is one of the best things that I can do for my, child at that time. And I truly believe within my own notion within my head that this is how my daughter got exposed to HIV. So in whichever aspect, it was a learning experience for me to understand, yes, I contracted the virus, through her dad exposing me to it, but because of my diagnosis, this baby was now exposed, and she never seroconverted. And this is why, again, I talk about the breastfeeding issue, because I did not know anything about transmission of breast milk, not until there was an article in the news, and my case manager one day, she called me while at the shelter and she said, "Michelle, stop breastfeeding the baby." She said, because we just found out some news that moms can pass HIV to their babies. So, I started looking again, the different aspects. I think my second level also too of, having to face with what I call a level of stigma and discrimination was then I became a client of a social service administration in New York called the HACA program, HIV and AIDS Service Administration, and I then was now a client of HACA, having to get housing placement, public assistance, for myself and my children. And every time I would go have a visit with my HACCP caseworker, she would spray the chair as I got up, to, I guess, to continue with my business. And she kept spraying the chair with Lysol. But part of my journey also, too, I'm a person, I guess with my upraising, I tend to ask a lot of questions. And I remember one day I said, listen, what is this thing that every time I would get up off the chair, you sprayed, the chair with Lysol? She says, well, you people, and that word started coming into my life, you people with this disease, you can expose us to HIV. And everyone, I have to say, 6 months into me being a HACCP client, the glorious day came when I looked at her and I said, listen, I understand the reason why you're probably concerned and you spray the chair when I get up. But one thing I'm going to let you know, I think you need to spray the chair before I get here because I have a compromised immune system. I don't know what you have. I have no idea what you're exposing me to. And my journey started. Because I made a decision within my life. I have to raise this child, both myself and her. This is a child who is born with the virus. She really didn't have a chance to know or understand. And many of the youths today, I'm not, pretty much, being demeaning in any aspect, but many of our youths today is still not under that notion or really knows and understands. Some of them who were being born with HIV don't even know their status. We are reading data today that's telling us now that I think it's something like 45 to 55% of the youths who are living with HIV don't know they are HIV positive, and they were born with HIV. So I tend to still see the gaps and the work that we have to do in reference to stigma and discrimination. But as my journeys continue, I think the more angry I got, the more I looked for tools and ways on how to address this, because I'm living with this. There's no cure for this disease, and I have to be able, as the medical field, the God that I serve, and my determination, I got to be able to live, and I got to be able to live no matter who I am. If you want respect, you got to give me respect. If you want me to acknowledge who you are, you're going to acknowledge who I am, but you're not going to use this virus to define who I am. You're going to talk to me, you're going to communicate with me, you're going to get to know me, and you're going to get the respect, because respect, it's a two-way street. But it was also to an opportunity for me as I went through these experiences, the more angry I got to understand what fear is all about. And I truly believe today, most of us who are having to deal with the stigma and the discrimination, we are dealing with individuals who are still living in fear. And it's 2012. And as much information that I can get, as I can put a word in, and it's related to HIV, you just attach HIV to it, tons of information comes up. So when we pretty much have to face the discrimination that you would hear some of us as individuals speak about, is because we are still having to deal with individuals who are within fears and have not made that step to say, you know what, I need to be able to get over this fear. Some of us, right, we go on these we go on these shows, and there's Fear Factors and all these other shows that pretty much, but I'm yet to see the show to help those of us understand that this is about people. We have a definition of what HIV, it's a human immunodeficiency virus. It's about humans. But many of us still don't view each other as humans, because we tend to look at someone with HIV. And, I have to say this, there is a form and there is a level of internal discrimination also too, and stigma that goes on within the population of those of us who are positive. Because now I'm beginning to talk about the class issue. There is a class issue within being diagnosed with HIV today, because I've heard the dialogues, and I always tend to say I give credit to the work, to my growth, to the things that I've learned, to the gay white male population. But it was not until one day one of my, he's like a brother to me. He said to me, Michelle, I'm a privileged gay white man living with HIV. And he said that being sincere, and he said that really to help me understand. Both of us, yes, we have something common in life, the HIV virus, but because of his income, because of his identity in society, he made it really clear to me, the gay white male population, in certain aspects of their community, they don't have to deal with the stigma and the discrimination. And at times I still even question that, because the gay community today is still having to deal with stigma, discrimination. So here I am as this woman of color, here I am being proud, and I always tend to look at today, my name, right now, today in my life, thank God to the First Lady. I now say to people, listen, if you can't remember my name, just think of the First Lady. I'm the First Lady of AIDS. You know, so I have to look again, because these are some of the tools. These are some of the tools in life. These are some of the tools that some of us who are living with this disease still have not put our hands on. As we face it, as we see the stigma, as we encounter it, what do we do with it? I remember the days of my daughter now having to go to school, and this child actually having to take, thank God today, she's in the room, I'm not trying to put her on the spot, but, you know, she has gotten it down, you know, with her advocacy within her own self. She is taking the one pill once a day. Mom is still having to take the handful of pills, because mom is not just diagnosed with HIV. You know, we tend to have so many other of the disparities or the other diseases that comes along living with HIV, and I think this is why also too, you know, I'm just elated now on what many of us who are the advocates forming what I would say partnership between government, between industry, between community, and how we really view each other as humans and how we can come together and be able to address the stigma, the discrimination, because many of us are very much aware of how stigma can cause someone not to disclose, to cause someone to actually not even realize how much they're putting themselves and even another person in the community, what I would say, at risk. Because in HIV, in our lives today, many of us are involved in discordant coupling. I'm in a discordant relationship. My partner is negative, and he's very much aware of my status. And I have to say, we form a team, because from day one, please don't let Michelle know the notion that you're interested in her, because you're going to get her whole life story. You let me know, girl, I like you. In our community, you know, this is how the brothers and they talk to me. Girl, I like how you looking. You like how I'm looking? Well, let's talk. This look that many of, the men in my community tends to be carried away about. And I'm not the video vixen. I'm truly not. But there's this look that comes with, I remember one gentleman one time saying to me, what a nice package. I said, yeah, and this package carries HIV. Because my disclosure, when someone comes on to me or give me that notion, that is my teaching moment right there to let you know. You're never going to see Michelle with a sign on her forehead saying that she's HIV positive. But trust me, Michelle looks for the point in time where the teaching, learning moment comes up. So if I'm in a cab and you flirting with me, flirt on, because I'm going to let you know, this woman, yes, I'm HIV positive, and I'm sharing my status with you to let you know and understand this is not about a look. I remember one time doing some work with United Nations, and I shared this experience doing some work with United Nations and actually encountering someone who's a prince from his village. And after I was finished speaking and I got down off of the stage, he came up to me and he said, my sister, if this is what HIV looks like, I'm good. I said, excuse me? So we tend, again, to look at these different events that comes into our lives and what do we do with it? And I always tend to capture the moment. If you give me the opportunity to educate you about HIV, I am doing something about stigma. Because for those of us who experience it, we may talk about it amongst ourselves, our peers, our friends, our allies, the advocates who comes together who are not living with HIV, but they gets it. We tend to speak about it, but within our own selves living with HIV, what do we do with it? So I'm always in the mode of what am I going to do about stigma, or how do I address discrimination and be mindful that we are still living in a world of individuals who are walking around with many fears, who choose. And I truly believe today, if someone is not educated about how HIV is transmitted today, I truly believe it's a choice that they made not to be educated. My most recent experience I can talk about. I'm a newly employee of a private medical center in downtown Brooklyn. I was actually called after 19 years of my employment at the organization that I work for because of an accident I incurred last year. I'm someone who is also too recovering from spinal injuries. My organization, when I got my release to go back out to work, actually informed me, because of the restrictions that you have, we can't accept you back as an employee. And I looked at this. This is the organization, I gotta say, they nurtured me. I was diagnosed at this organization, and this is an organization who proudly provides care and access to treatment for the uninsured, underinsured, undocumented, and the minority community. But now, here I am as an employee, and I've given my 19 years. My restrictions, I can't pick up anything over 10 pounds, which I've never had to. And the other restriction is to allow me to stand and sit within 15 to 20-minute periods because of the spinal injuries. Now I get spasms in my back. And these restrictions cannot be accommodated by my job. So is this stigma? Is this discrimination? What is this? This is what goes on in the corporate world now. HIV is out the door. She's no longer the positive person who everyone wants to support. You're a staff. And if you can't produce, so I tend to look at, again, what do I do when situations like this comes up? So my 19 years of service, I thank them for allowing me to work with my community for 19 years. And I was offered, while I'm going through my processing of getting back to my job, I was offered another job. I was called, and Michelle, we're looking for a director to direct an HIV program that we would now like to integrate into our specialty primary care. That's my God and the way He works. Truly it is. So my 19 years of work has not gone in vain. And there's no malice with this agency no longer to accommodate me. I'm at a level now where I can continue to help the Michelle Lopez's and their partners. Because for those of us who are heterosexual, we know that. And for anyone who's living with HIV, we didn't get it by ourselves, right? Again, it's about people. So the Michelle Lopez's that comes through the door, whoever her partner is that she identifies to me, if she's in a relationship, because I truly believe that's another conference, the domestic violence and the deaths that many of us as women, because of us disclosing, because disclosure is a large part of how we address the stigma. Some of us has made the decision we're not going to walk around in shame, and we're not going to walk around feeling guilty. We're going to disclose our status to the partners who we are with. But God forbid, this is a partner who does not have the understanding and the notion of realizing I disclose my status to you because this is about the both of us now. And this person would not pick up a gun and put a gun to my head and kill me because of me disclosing my status. But this person will choose to learn and understand what it is living with HIV and how there are things that we can do as a discordant couple to prevent this person from being exposed to HIV. And now we're learning of therapies, access to care and treatment can prevent HIV. Those of us who are living with the virus, if the infrastructure is there and we are retained in care and we are adherent to our regimen and we have undetectable viral loads and our doctors have formed a partnership willingly with us and not having to navigate our healthcare needs being ostracized, but in a setting where the partnership is real, we can have relationship, we can be intimate, we can find love again, we can have babies, we can start families living with HIV. But that person on the other end who is negative understands, and that person was willing to come together with me and address HIV as it's about us, outside of being married. And I'm going to say that because out of, I came from a family. I have a very large family, and I came from siblings. I'm the last of 6, but I'm also the 3rd female in my family to be living with HIV. Myself being the last girl, my daughter now being born with HIV, and my oldest sibling, my mom's first daughter, she's living in Trinidad. That's where I'm from originally. She's living in Trinidad with HIV and have no idea. Literally on a Sunday, whenever I call my family, the cry I hear from my sister, she says, "I am so proud. And you continue to keep me alive because of what you're doing in New York. I wish you can come back home and do what you're doing, because the stigma and the discrimination down here is what's killing me. The lack of doctors understanding what it means to treat me as a human being living with HIV, that's not prevalent here in Trinidad, Michelle." And one of the areas of my life that I tend to always look at is how and what I've put into raising this child who is now, she's now a young woman, she's 22, but having to go over to her school on a weekly basis and sit with teachers, because these are teachers now who I chose to disclose to the school at her young, tender age of her being diagnosed with HIV, because this kid had to take a handful of medications back in those days. And as soon as a teacher who was assigned to her knew that this kid was living with HIV, they literally said to the principals, "We can't teach this child." Some choose to put on gloves to teach her. Some choose to not allow her to go to the bathroom, because if she goes and uses the bathroom, she's going to expose the other kids. And these are the things that we dealt with. But these are the things that we experienced, that I took those experiences and I didn't throw in the towel. And I didn't get into fist fights. There was some profanity that I used through my educating them. But I have to say, it was not until she turned 14 and she was at school one day, and one of her peers bought a magazine at school, because Pause magazine, which is one of my magazines that I truly, truly love and have always embraced the work that comes out of that magazine. Pause magazine did an article on my daughter, and her peer found this magazine And he brought it to school. And this was the week before, the last summer semester, starts for them going out on summer vacation. And he came into the lunchroom, and if anyone knows what the lunchroom in junior high or high school, but this happened to her while she was in high school, what a lunchroom looks like, and, kids hanging out, and he got up on a table in the lunchroom and said, "Yo, you guys hanging out over there, and all you all just, chilling with Raven. You all know she got the monster?" And they opened up the magazine. And what I learned from my daughter was that this school allowed kids to spit food on my daughter, to stomp her. And the principal getting on the phone and calling me and saying, "Miss Lopez, you need to come to the school because I think your daughter is having a moment." And when I got to the school to find my 14-year-old on the floor in a fetal position because she was in pain. She was in pain because of the discrimination that she encountered from her peers. But it was not until she looked up and she pulled herself together because Mom was here. And she said, "I'm not going to take this anymore." She said, "Ma, I can't deal with this anymore." I said, "What do you want to do? What do you want us to do?" Because I truly believe that's when she said, "I've seen my mom with her armor of battle." But I also to realize that day, she decided to put on her armor of battle. And she said to me, "Why don't you call those people that you always talk about?" I said, "Who people?" She said, "Ma, you know all the people in the news. Call them. We're going to hold a press conference at this school." And the day before her birthday, she facilitated her first press conference in front of her high school. And every one of our local media came out because they needed to hear from this child who was living with HIV, who the Board of Ed, authorities in her school allowed her to be discriminated upon. And she was stigmatized, and food was spat on her. But she did something about it. Because when she got in front of those cameras, it was her moment, her words, not my words. Because I have to say that morning, Mom was prepared to talk to the news. And she looked at me and she said, "I got this. I'm going to talk." But she educated her peers. She educated the media. She educated society on what it is that we are doing as individuals for the lives of people who are living with this disease, who don't have a voice, who thinks that they don't have a voice, who feels as if it's not their right to speak up about what their experiences are, who don't have a notion that they can form partnerships with allies and individuals who don't live with this disease but who gets it and who's willing to join arms with us and stand up together with us and say, we're not going to take this anymore. But this is a constant work. So some of us get downright burnt out, and some of us step back. But as we continue to live, we are always mindful, this disease that we have learned not to allow HIV to define who we are. So when I'm with my peers and I hear someone who's living with HIV and they introduce themselves and they say, "Hi, I'm Michelle and I'm HIV." No. You are not Michelle HIV. You are Michelle living with a virus called HIV. And it's part of the work that I continue to do with my peers. We own it, we claim it, but we are not the virus. This virus is horrible. It's ugly. What we see on the outside is not what's going on the inside. What we have accomplished. It's part of our journey in life, and we continue to grow. We continue to form the relationships that we tend to acquire, but we are never, ever forgetful of what we are living with. So as I stand here today, and I really do want to be mindful of my time, I will continue to say, stigma is real. Discrimination, I truly believe, will continue in life. But for those of us who understand and gets this, I ask you one charge as you leave here today. World AIDS Day is not just December the 1st. Be mindful, we have an opportunity to do something about stigma every day when we see it, if we experience it, and if we read about it. Continue, and I thank you for all of our allies. Continue to form the relationships, the collaborations, the allyship. We can end stigma. Thank you.